I have a whole family of chiropractors. My dad is a chiropractor. I have two brothers that are chiropractors, but they are not upper cervical chiropractors. And I've been adjusted my whole life. I totally believed in chiropractors, but as I got older, that type of chiropractic just didn't work for me anymore, and it was actually causing me more pain. It was irritating my spine, and I was getting in more and more pain the more chiropractic I had. So I kind of just decided, well, I don't really believe in chiropractic anymore. And I stopped going. I hadn't gone for maybe 4 years when I met Kyle. And I was really excited to have something different because I really did love the whole idea behind chiropractic. And we had our first meeting with Kyle where we talked about some of the benefits that could happen from chiropractic. And we also had our kids come. And my oldest son, who was 10 years old, had been having problems getting to bed. And his whole life, he had never overcome that problem and really wanted to. But we just couldn't find the answer for him. And when we talked to our physician, he said, oh, well, he'll grow out of it. But we were like, gosh, he's 10, you know, I mean, that's kind of old. But he said, well, maybe when he's 12, he'll grow out of it. And we thought, oh, that's really old. But, and we tried not to put pressure on him or do any of those things that they say are bad. But he really, really wanted to do better. And Kyle let us know that there's a possibility that when he was adjusted, that it would help his bedwetting problem. And he mentioned that it could take a while, that maybe 3 months, maybe even longer, before his body responded. And after my son's first adjustment, he never wet the bed again. That night he didn't, and it has been over a year and a half. He has never wet the bed again. And I absolutely believe that is because of the chiropractic that he's receiving from Kyle, that that problem for him was solved. And it's just amazing to me, and it's been really the first blessing that we experienced from coming to Kyle was having his bedwetting problem solved, and how happy we have all been for him that he doesn't have that anymore. So that was our first really good thing that happened. Because I grew up in a chiropractic family, I knew that I had sort of a reverse curve to my neck. And Kyle said that could probably be helped a lot with the kind of chiropractic that he did. And I was excited about that. I'd come from a family where my back got popped all the time. So I have to admit that when I first started coming to Kyle, I was like, wow, this is kind of weird that he can just do this one little pop. And compared to all the other pops that I've been getting my whole life, and have it work. And I also had never, obviously, gone to a chiropractor and had him not adjust me. So there was definitely some mental things that I just had to go on faith a little bit and be like, well, I want to get better. I really desire long-term health in my life. And I loved all the education Kyle gave me. Every time I come in to get an adjustment, he's talking to me about scientific research and teaching me about why I'm in here and what it's doing to my body. And I just really, really appreciate having that scientific background. It means I don't have to go off of complete faith. There certainly is an element of that to chiropractic, I think. You can't prove everything that's going on. Our bodies are pretty miraculous, and we just don't understand everything. But still, Kyle's been really great to talk to me about the things that are out there that are kind of backing up what he's doing, and I really, really appreciate that. And I have noticed lots of great things going on. You know, when I was first coming to Kyle, I did have somewhat chronic headaches, chronic neck pain, back pain, and I just thought, well, it's kind of part of life. You know, you have it sometimes, you don't sometimes, and it's just part of being human, having a back, walking on two legs, you know. But I have started noticing that I don't feel pain anymore. I come into Kyle and I'm not even in pain. I'm just here for follow-up, to check, to make sure that I stay on that path of no pain. And I love it. It's surprising to me because I spent a whole life thinking that it was just part of life, and you went to the chiropractor when you were in pain. And now I know that if you just keep on a good schedule, and with the kind of chiropractic Kyle has, you don't have to be in pain all the time. I think the last story that I want to share is I had pretty much what I feel like is my first migraine that I ever had in my life. And I was just in so much pain with a headache that it was making me cry. And I'd never had that before. I'm almost 40. Never had that in my life. But I had this headache, and I was just like, oh, this is horrible. And called Kyle, and he was so great to work around his schedule, fit me in. He got me in, worked on me, and my headache went away within an hour. It was gone. And I was really shocked because I'd had some bad headaches. Usually I would call my headaches like 3-day headaches, but they were never that bad. And never have I had that kind of instant relief. Well, not instant. It took like an hour. But next day, I was totally fine. It's really better. And I'm just so grateful for the ongoing way that Kyle is helping me and my family, my children, husband, me, have health. And that kind of permanent health that I want in my life, that he is giving my body the way to heal itself and to take care of its own problems. And Kyle's funny. He's fun to talk to, and he's smart, and it's really nice to have him from our chiropractor.